Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is episode 1400 of Chef AJ Live. Who knew that when I live streamed the day the pandemic began, at least in my county, on March 20th, 2020, to create a sense of community with my community, that people would watch and still almost 3 years later, 1,400 shows later, be watching. So we had to do a special show. So I decided to talk about food addiction today because it's a subject near and dear to my heart. And we're coming up to the weekend where we start the 5th annual Truth About Weight Loss Summit. And the more and more I interview people in the weight loss space, I realize that weight loss and food addiction are really, opposite sides of the same coin. And to treat one, you really have to treat the other. They're not separate issues for the most part. Of course, there may be some exceptions in some people. So I brought together a group of people who really are on the front lines of treating food addiction. You know some of them before. Dr. Vera Tarman has been on my show. Dr. Goldhamer has been on the show. Both have been on many times. But new to the show today is Painschab, and she's going to tell us who she is and why she's so interested in getting Dr. Goldhamer's perspective on this subject. When I came to the True North Health Center 12 years ago, obese, as I had been for the first 52 years of my life, I met Dr. Alan Goldhamer, the co-author of The Pleasure Trap. And after reading that book, I realized that the pleasure trap and the food addiction really are one and the same. There are many people out there, including healthcare professionals, that don't believe in this concept of food addiction. And many of them that are working in this field also believe that you can't be vegan and manage or cure food addiction, which I think is absolutely ridiculous. I've heard people tell people that I have sent them to get help that, well, you need animal protein to heal brain neurotransmitters and other such nonsense. So people can be vegan or not be vegan, but it's not true that you can't treat and manage food addiction. And that's what I like about Dr. Tarman, is because she allows people to be vegan and still will help them with food addiction. But believe it or not, there's a lot of groups out there, including 12-step programs, where it's not allowed. So please welcome everyone to the show. I'd like to start with you, Molly, because you're new to the group. So maybe you could tell the audience a little bit about yourself.
Sure. Thanks for suggesting this. So my name is Molly Painschab. I'm a dual licensed mental health and addiction counselor in Montana, and that's in the US. So if you have any international clients, I'm in the US. So I came to the world of food addiction and treating food addiction probably 3-4 years ago, really coming from the world of substance use disorder, mental health, finding my own story, reading Vera's book, realizing that, there was truth in that for me. Doing Esther Helga's program out of Iceland, meeting Clarissa Kennedy, who is like our, we are the trio, Dr. Tarman, Clarissa, and myself. And then I decided to co-chair this food addiction professional network. And that is my, in a short way of telling my story, why I'm here today, my interest in this, and why I'm so excited to have this conversation with you guys.
Well, thank you. And I would like, if you don't mind, for you to ask the questions to Dr. Goldhamer, because the ones you sent me really are more for a clinician, someone who's a doctor. The last two, I think I can speak to with some expertise, but we'd love to get Dr. Goldhamer's take on this, because Dr. Goldhamer, how many people have come to the True North Health Center in the last 40 years? Isn't it something like over 40,000 patients?
Yeah, we've had 25,000, I know, that have undergone fasting, and we've had probably close to twice that many that have actually been through the center.
Fantastic. Well, I appreciate your expertise on this. So please, Molly, take it away.
Absolutely. And thank you again so much for doing this. So really the intent behind this was, much like you set us up with Chef AJ, was that there are a lot of myths that are out there. And so to better help our clients who are vegan and vegetarian, we were really hoping for the two of you to give some input. And our first question is, how can we help our vegan and vegetarian clients get enough protein? How much is enough protein? And are there specific sources of protein that we should direct our clients toward that, they're more satiating or more beneficial?
Well, it's an interesting place to start, because I think it's also an area where there's a lot of misconception. I think there's a general consensus about 10% of calories from protein have to come from, or 10% of calories in the diet come from protein, more or less. But the real problem, at least I see clinically, is that people are on excessively high protein intakes. And that excess of protein, just like too little protein, can pose a very real clinical problem. know that excess protein, particularly excess animal proteins that are rich in high sulfur amino acids, are associated with increased risk of disease processes like osteoporosis, like kidney disease. The bigger concern I have clinically is how do I keep patients from getting excessive amounts of protein and excessive amounts of fat in the diet so that their needed protein, that 10% of calories, is going to be appropriate, because many people are on twice or more than that. Also now, because people have this idea that low protein intake is a major concern to them, they may supplement protein, not just with very rich animal products, but also protein powders and other highly processed, highly fractionated foods, thinking that getting more protein in that's going to be helpful to them in their overall process. So one of the basic premises I would argue is that you absolutely need to get enough of each nutrient and you need to avoid getting excess, but getting excess is much more common than getting deficiencies. And dietary excess is actually one of the leading contributing causes to the premature death and disability that we see in patients. And it's usually the excess protein and excess fat that are the primary culprits. Obviously, the other big misconception is treating all foods the same, like all carbohydrates are the same. So refined carbohydrates and hyper-concentrated sugars and complex carbohydrates are all the same. And so we try to throw the baby out with the bathwater by, eliminating all carbohydrate intake because of the very agreed upon damages that occur from excess amounts of refined carbohydrates in the diet.
So is there a number that you shoot for, like when you're trying to figure this out? And if so, does it vary person to person, or do you have general guidelines? How can we help our clients?
You want to get about 10% of the calories to the total diet. So if the person's total dietary intake is derived exclusively from whole plant foods, they're going to get around 10% of their calories are going to come from protein. So depending on their caloric intake would determine on their needs. So obviously, an 86-year-old female that's relatively passive may have different needs than the 24-year-old male manual labor competitive athlete. So, but the difference is not going to be in how much percentage of calories of protein they need. It's going to be how much total calories they consume. And if all of their food is whole natural foods, they're always going to get around 10% or so of their calories from protein, unless they try to increase their protein intake by using a higher percentage of highly concentrated foods, or using food byproducts, or using animal foods.
Right. So you're not looking for a specific gram number or anything like that. You're taking
if a person's
a bigger
having
picture.
2,000 calories, they're going to get around 60 grams of protein. So you do. It's a math problem. But it's just like saying, well, how much calories does your person need to eat? Well, that depends on their age, their size, their metabolic rate, their metabolic, individual biochemical individuality. But it's always going to be around 10% of calories of protein, ideally.
Okay, great. And then are there any specific sources of protein that you recommend, that maybe are more satiating or maybe are more beneficial in some way, shape, or form?
So when you're a child, there's about 10 amino acids that are essential. As an adult, there's about 8 essential amino acids that are necessary. And it turns out pretty much no matter how you put a variety of whole plant foods together, you get all the essential amino acids that you need. And so if you're saying you're worried that, say an individual needs 60 grams of protein a day, are they going to get enough of each of the essential amino acids? It turns out the rate limiting factor for amino acids is not the essential amino acids, it's total protein. So if you break these diets down, it turns out some foods like that you wouldn't normally think of, like brown rice and broccoli. Well, if all you ate was 2,000 calories of brown rice and broccoli, you're getting around 80 grams of protein a day and all the essential amino acids. And the rate limiting factor compared to the RDA is the total protein, not the essential amino acids. So there is no problem getting enough essential amino acids. There is no problem getting enough total protein, if in fact the food's all coming from whole natural foods. Now, in fairness, a lot of people get up to 25% of their calories from alcohol. Some people are getting as much as 50, 70% of their calories from refined carbohydrates. People are using oil and other fractionated foods. The average person is only getting about 7% of their calories right now from fruits and vegetables. And so if you're trying to get all of your nutrients from 93% of things other than fresh fruits and vegetables, you may run into deficiency problems, isolation problems, excess problems, all kinds of problems. The problem is the diet. Is the diet derived from the foods we're designed to eat, or is the diet derived from highly fractionated, processed, refined materials that are a byproduct of the Industrial Revolution rather than, what our bodies actually were designed for? If you think about human beings, we've been on the planet for tens of thousands of years in our current form, in this modern human form. We've only had access to highly processed foods since, at the most, the Industrial Revolution, and really the last 70 to 100 years. So we had a long time to deal with a whole plant food diet, and we've had a relatively small amount of time to deal with these highly fractionated processed foods. And that's why in nature, you don't see obesity. Even animals like whales, which people think of as fat, are not fat. They're 9% of body fat. They're a lean, mean machine. They happen to wear their fat on the outside of their body. There is no obesity in nature unless you give them access to highly fractionated processed foods. Even if the animals are highly stressed, even if the circumstances, they've got problems in their life and mommy rat didn't love them enough or daddy rat loved them too much, they're still not going to be able to sustain obesity unless you mess with the diet. Because
I think about the raccoons.
Mechanisms, will moderate it. And that's why in nature, you don't see this problem unless you give any of those animals access to our type of highly processed fractionated foods. Then it becomes ubiquitous, just like it is with us. And not coincidentally, they develop the same diseases we develop. The cancer, the heart disease, the diabetes, the autoimmune diseases, they get depressed, they get anxious. They have the same type of imbalances that we have because it's the diet.
Got it. Okay. And you had said, okay, so if you're eating whole plant food, a food plan that's whole plant based, you're getting enough amino acids. What about vitamins and minerals? Do you have to supplement?
Yes. In a natural setting, you would not have to supplement, for example, vitamin B12. But in a modern hyperhygienic environment, the only source of B12 for humans is bacteria. Now, if you're eating meat, you're going to get a lot of bacteria, not the least of which is from the fecal contamination that's so inherent with, ground meat. If you take ground meat and you separate it into the meat molecules and the fecal molecules, you'll find there's a nice pile of feces in every mouthful of ground meat. That's not what we would consider the best source of B12. And in the modern world, because we don't want worms and parasites, so we wash and we peel and we take care of business, we can reduce our bacterial contamination exposure to the point where B12 becomes a limiting factor. Now, it takes people years or even decades to get depletion, but eventually you can get depletion of vitamin B12. And that's why it's the one and only nutrient we recommend across the board for vegans, that they supplement 1,000 micrograms of methylcobalamin a day, just to make sure that that's not an issue. And in my practice, I've seen a lot of vegans develop B12 problems that don't supplement B12. I've not seen that problem arise in patients that do supplement B12. So the other nutrient that is a common problem is another nutrient not normally inherent to the diet, but from this interaction of sun with our skin, and that's vitamin D. In a natural setting where humans spend most of their time, that is in the tropics, where there's a constant supply of, a readily supply of food, sun exposure was ubiquitous, and D deficiency was probably very rare. But because D is formed by the interaction of sun with our skin, if you live very far north, like where I live in Santa Rosa, California, half the year you can't make vitamin D. The sun's not hot enough. And so again, if you live inside behind plate glass windows that filter the UVB, you can develop vitamin D deficiency. So we routinely test patients for D, and a significant percentage of people do run low. And so those people either have to get out in the sun and do some exercise or gardening, or they need to take a decent supplement. Of course, too much, just like protein, D can be very serious. And so it's important that you get enough, but not too much. The big theme that we find in practice is certainly deficiency of anything is a problem, but a much more common problem is excess.
Can I ask a question?
Sure.
I'm going to back up a bit because, and pardon me if I sound stupid here, but you've said a couple things that I want. Maybe it's myth busting here. I heard you say that if I eat rice or some sort of grain, I don't remember what it was.
Rice and broccoli.
Yes, well, okay, not broccoli, brown rice. Broccoli and brown rice, and if I eat 2,000 calories of that, I'll get enough protein
You'll
in
get 80 grams of protein on 2,000 calories of brown rice and broccoli, 9 cups of broccoli, 6 cups of rice, 2,000 calories. So if you got your calorically sufficient amount of brown rice and broccoli, you would get not only enough total protein, you'd actually get a little too much protein, and you'd have all of the amino acids. The rate limiting factor, I believe, is 175% of the RDA. And the reason for that is broccoli is 25% of calories from protein. So the problem is that things like lettuce and that you don't think about as a source of protein are actually very concentrated source of protein. However, most people, it's the decoration on the plate. They don't eat any quantity of it. The vegetable is the parsley on the plate. They don't eat it. It's just something to sit there to make it, and in the diets that we feed patients, they're eating large quantities of salad, steamed vegetables, potatoes, rice, and beans. But even without the beans and the nuts and the more traditional concentrated sources of protein, there is no problem getting the quality or quantity of protein people need to sustain health. And on a whole plant food diet, it's a little bit easier to avoid the dietary excess unless you resort to protein powders or other kind of concentrated proteins.
Right, which I'm hearing you say loud and clear you don't approve of, you don't think is necessary.
No, I would recommend against these, even for people that are trying to increase their protein level because they're trying to do athletic competition or they're trying to do bulking stuff. It would be much healthier to do it by increasing naturally rich sources of protein in the diet than it would be using these highly fractionated processed foods that people are hawking as some kind of health foods.
Okay, so the reason why I asked that question is because maybe it's a misconception, but I generally think of these cauliflower and brown rice as a carbohydrate, not as a protein source. Well, and that one of the reasons that I've understood, so please clarify this, is that the protein may be there, but it's not as digestible or as accessible as it is in a meat product, for example. So can you comment on that?
The question is whether or not it is true that animal proteins may have a higher degree of absorption. They may have a slightly different ratio of amino acids. The question is overall, is the integrity of the diet sufficient? For example, let's say, for example, you want to put a lot of muscle on a chimp on a grade ape or something. Could they do it from eating plants, or would they have to eat animals? Well, no, it turns out that the plant-based diet is highly absorbable, highly digestible, and more than adequate to meet protein needs. And in fact, the fact that it's slightly less percentage efficient may actually be slightly protective. Because as I said, even on these plant-based diets, excess protein is actually the real threat to health. There is no not getting enough protein in industrialized, calorically sufficient diets in post-industrialized countries. Dietary, you don't see kwashiorkor. You've never seen it in a practice in the United States, probably. The only time you ever see deficiencies of that nature is going to be in alcoholics that are deriving 80-90% of their calories from alcohol and aren't getting any nutrition.
I think we agree.
Protein deficiency, and in fact, you do see the consequence of protein excess every day. You see it in all over the place. So I think that yes, not getting enough protein would be a life-threatening, serious problem, but it's not going to happen on a whole plant food, calorically sufficient diet. Can't do it.
Okay, go ahead, Molly.
Wait, may I just interrupt just for a second, because I want to clarify one thing. When Dr. Goldhamer, when Molly asked you about like the protein, should there be special kinds? The reason I'm not sure this is why she was asking, but I know that people I know that were vegan that went to certain food addiction groups for treatment, they were told that the only acceptable thing they could eat is beans and nuts, and they had to eat them at every meal to recover. Now, wait, let me just finish for 1 second, please, because if that was me 11 years ago, and I went to that group instead of you, I would never have recovered because I cannot eat any legumes. I don't eat any legumes and I can't eat any nuts. So that is what they're taught. Like every meal has to have, like soy or nuts or something like that.
So this goes back to the 1960s when people thought that in order to get complete protein, you had to have all the amino acids at each meal and each mouthful or whatever. And a complete misunderstanding of what actually makes up, for example, a whole plant food diet. What's actually in there? What are the raw materials that you're fishing around with? So it turns out you do not need to have every perfect ratio of every amino acid at every meal. It's the diet as a whole, the integrity of the diet over the course of the weeks and the months and the year. And the diets, as I mentioned, they're not even rate limiting on essential amino acids. They're rate limiting on total protein. So this idea that you're not going to get enough protein, you got to have it at every meal, or that's a critical issue to whether it's optimal nutrition or to satiation, is just unfortunately not true. It's just a misconception that's been passed on kind of without really looking at it too critically, in my opinion, for decades. And it's completely understandable because it was taught and it sounded right and it made good. And it was reinforced by the animal industry that complete proteins and everything that was taught in school, and the food pyramids and all the other advertising campaigns that were passed off as health education literature. And so, people believe that, but the fact is, just because they believe it doesn't mean it's true.
But what do you think of this idea? And I won't say the name of the practitioner, but I've been on summits with this individual who basically says, and there are a few of them that I don't even understand this statement because Dr. Greger, I thought, debunked it in one of his videos, that you cannot heal brain neurotransmitters without animal protein.
Well, I see absolutely no data to support that. So if that's true, I'd sure love to see on what basis they're making that argument. But AJ, people say all kinds of things, some of which is true, some of which is false. Our job is to try to soak it all up and then use the best we can to make the most sense we can based on our experience, based on the scientific literature. And in the case when you make a statement like that, it's incumbent upon the person making the claim to kind of show you on what basis are they making that argument. And if that were true, I mean, you can think about all the downstream consequences that you'd expect to see. Particularly, you've got whole cultures that are religious vegans and don't ever use animal protein. I've got thousands of patients that have not only not developed cognitive difficulties, but actually recovered from those very issues. So I think we can kind of argue that's probably not on its surface accurate.
Well, Albert Einstein was vegan and he was one of the smartest people that ever lived.
Oh, there you go.
I think his brain neurotransmitters work just fine. All right.
Yeah, absolutely. And yeah, exactly. So, I mean, that is part of that, part of the reason for that question, as far as like, are there specific sources of protein? Because when people are being given that suggestion, right, that it's just beans and rice or whatever, you want to be able to give them other options. So that leads me to, can we overdo something like tofu or other soy products? We had a clinician reach out with this question, and she said, I've heard that soy can interfere or disrupt estrogen. When, if ever, would this be a concern?
Well, it turns out that was a concern because the phytoestrogen is naturally inherent in soy products that they thought might be protected for women and other things. It turns out the concern about phytoestrogens was probably dramatically overstated. I don't think that there's any real support in that. I think Jeff Novick has done a good video kind of debunking that whole concept. So I don't believe there's actually any evidence about concern because people have some soy products in their diet. However, I would argue that tofu, for example, is a highly processed food. It has 55% of its calories from fat. I don't know that you'd want to eat it with abandon and treat it without some respect. I think that all these hyper-concentrated, even plant foods, like nuts and seeds and these foods, should be treated with some respect and some proportional control. Because if you just ate tofu or you just ate almonds or whatever, you'd have a diet that wouldn't be 10% of calories from protein, 15 to 18% of calories of fat, and the balance coming from complex carbohydrates, which is what most of the literature supports as a long-term sustainable health promoting diet that not only helps people live to their potential, but avoids the debility at the end of their life. And we have to be very clear here. We're talking about what's the type of food that people should eat, not just today that might help them with their short-term weight loss, but what's going to help them sustain a long and healthy life. And not just extend their life expectancy, but help their healthy life expectancy so that they can spend the last 10 or 20 years of their life fully functional and not unable to talk or move, lying in some nursing home bed waiting for people to change their diaper. And sometimes what's good for short-term gain is not good for long-term health maintenance. And we see that specifically in people trying to train for athletic performance and other things, where they go on very high-fat, high-protein diets. And it might make their muscles bigger faster, but it isn't necessarily a sustainable long-term health promoting program. So, my practice, I have a very specific goal, and that is to help people not only overcome their illness, but to live a long, healthy, and functional life so they not only have a good life, but a good death, so that when they reach their genetic potential, they go to bed one night and don't wake up, rather than be debilitated for years or decades. And right now, people are medicated in our society, not so much for their condition, but for their diets. So if you take, for example, a patient with high blood pressure or diabetes, The moment you change their diet, you have to start modifying their medication profile. Long before they've lost their fat, everybody thinks it's the fat that's the problem. And they say, well, you got fat and it has visceral fat, and visceral fat produces IL-6 and TNF alpha, and it's pro-inflammatory. And that inflammation is what leads to heart disease and diabetes and cancer. And that may be true, but it's the diet that creates that problem. And the moment you change the diet, things change. And now you have to start reducing medications and other things long before you've eliminated all the fat. That's a very important point, because we're blaming fat for, not that there's not a problem with dietary excess accumulation, and not that visceral fat isn't a problem, but that's only part of the picture. The big picture is the diet. And the moment you change the diet, you change the health risk factors. And guess what? The extra weight starts going away too. But the health condition can recover long before you've lost that last bit of extra fat storage. So people treating the fat as the main problem when it's really the inappropriate diet that's the main problem. The fat's just an inevitable byproduct, and an unfortunate consequence of poor dietary choices.
Yeah, I couldn't agree with you more there. So I want to change gears just a little bit. Something we often encounter in the food addiction space is that we get people off of these, hyper palatable foods that are lighting up their brains like a Christmas tree. And then comes, then the next thing that they want to work on is this idea that they have volume addiction. But I've heard you speak about volume. And so I'm wondering, is volume a part of satiety? Do we need volume from an evolutionary perspective? Is it an issue when you're eating a whole plant food? I just have so many questions for you about volume.
So volume, I think, is a critical part of satiation. And there's one, we know this. I don't think there's a lot of controversy about the fact that there are stretch receptors in the stomach. And the problem is, if you fill up the human feeding bag with high nutrient density, low caloric density foods, you get 500 to 700 calories or so, and it's full, and you start getting some feedback. However, if you fill up that feeding bag with very concentrated foods like flour-based products or animal-based foods or oil, these kind of things, you can get 3 times the caloric density, 3 times those calories without activating the stress receptor. So one unfortunate consequence of eating a very highly concentrated, highly processed, refined carbohydrate, animal-based diet is you don't get the full bang off your stretch receptors. And so there's not the satiety response. And also, if you eat very quickly and you don't chew your food and you don't allow some time, by the time you get feedback from stretch receptors, you may have already overeaten when you're eating highly processed foods. When you're eating salads and steamed vegetables and very nutrient dense but calorically not dense foods, it's much more challenging to overeat. Not that you can't do it, you can overeat on anything. But it's much more challenging because in a normal human being, they get some pretty good feedback from stretch reception. Now, not everybody gets the same degree of feedback. There's biochemical individuals. So some people may not have very sensitive stretch receptors. And so they can't count on that as the only factor to help them regulate quantitative control. Other people are exquisitely sensitive, so much so that if they try to eat a whole plant food diet, they may not get enough caloric density in, and then they get really skinny because their brain is telling them, oh, no, you've had enough. But, they're not relying on the other factors like, fat receptors. And, there's all kinds of complicated neurochemistry going on to make sure that we get enough to eat, but not too much. And it works perfectly on a whole natural food diet in most all people and most all animals. The only problems that you get into is when you take an individual and take them away from their natural diet. If, let's say, they have a little less sensitivity to stress reception than the average person, now you put them on a highly concentrated diet, they're going to get overweight much easier than somebody else might. It may not be a personality defect. It may not be a psychological problem. It may just be a biochemical difference. There's also differences in people. Some people are much more efficient absorbers than others. There are people in our society that are highly more efficient at absorbing food and particularly storing fat than others. Those people are called women. Because women are full of estrogen, which is a fat storage hormone. If you take men and you shoot them full of estrogen, they get fat, they grow breasts, they get hips, they have a completely different response. If you take women and inject enough testosterone in them, they lose their fat. And then they get hairy and get cancer and die. So it's not a good strategy for weight loss. But these are biochemical differences, biological differences. These are not psychological differences.
And they get visceral fat too. But
Well, absolutely. So the problem is,
Dr. Goldhamer, I want to let's talk volume. We both, all of us agree that the refined products are not of any good. But let's talk volume, even of healthy, even of plant-based, of like broccoli and Brussels sprouts and all that stuff. So we're coming across people who, even with eating healthy food, need to do the stretch receptors. But let's talk, what does volume mean? Now, Chef AJ and I, we've had a conversation and shared. I hope you don't mind my sharing what you said.
Not at all.
But you love Brussels sprouts, and so do I. And you said that you could eat as much as a pound, 16 ounces.
Oh, I always eat a pound. As a matter of fact, for breakfast, I had a pound of Brussels sprouts. And at 11 o'clock and at 1 o'clock, I had lunch.
And that could be considered
350 calories.
What? Sorry?
It's a pound of Brussels sprouts is about 350 calories.
Yeah,
No,
not
it's
talking
not.
calories.
It's 200. Listen, I had a pound of Brussels sprouts at 11 o'clock. It was 200 calories. And at 1:30, I had my lunch. It was a sweet potato that weighed 2 pounds and another pound of broccoli. But I
Yeah.
still, yeah.
So that would be considered volume to some of us who are like virtually doing, like, I don't know, 8 ounces tops.
I know, but
their
the
whole
thing
meal.
is,
The
you
thing
guys
is, you're only eating 8 ounces, you're only getting 100 calories.
Yeah.
So the problem
yes.
is that if AJ was trying to eat a whole plant food diet and wasn't eating a larger volume, she
Yeah.
would disappear.
Yeah. So your volume might be what, I mean, Molly, what do you say to that? Because, like, we have to define what normal volume is. So I can eat as much as 24 ounces of vegetables. And I'm thinking, wow, I'm almost embarrassed to say that, except to Chef AJ, because we share.
Wait a second though, if we look at all animals, they eat huge volumes of low density foods.
Yeah.
So we're also designed to eat large volumes of low density.
So maybe it's not volume addiction. Maybe in fact we're trying to achieve what we should be if we're eating vegetables.
Absolutely. That's the mistake with the weighing and measuring programs. When they weigh and measure things that they shouldn't be weighing and measuring, they're weighing and measuring the things that they shouldn't. Here's the way we do it. And the reason we don't use weighing and measuring is because we just don't eat most of the foods that you have to weigh and measure because they're the hyper concentrated foods. The only exception might be there are some plant foods that are just naturally really concentrated, like nuts and seeds. And so we want people to portion control those because it's easy to overeat those. But even those foods, if you get people to eat them like walnuts in the shell, where they have to peel the shell, by the time they get through 6 walnuts, they got to move on with their day. They run out of time. It helps. But when you're eating foods that you shouldn't, from our viewpoint, you shouldn't be eating, like flour-based products and highly processed foods, unless you weigh and measure them, it's inevitable you're going to overeat. And then the problem is if you tell people, oh, we have to weigh and measure everything, then when you want to get them eating enough of the low density foods so they don't overeat, they don't get enough in. And then they disappear, and then you're never going to be successful. If you're biological deficit and you're hungry, it's not going to work.
But one of the things, and I don't know if Dr. Tarman or Molly has read my book, I don't eat anything with caloric density. I don't eat nuts, seeds, avocado. I eat no oil. And I know that on food addiction plans, they insist, I believe, on 2 tablespoons of oil. If I didn't eat huge volumes, I would get too skinny because none of the foods I eat have more than 500 calories per pound. I eat any kind of fruit, any kind of vegetable, any kind of gluten-free whole grain, and any kind of sweet potato, or squash. These foods are so low in calorie density. And if you really look at evolution, our ancestors did eat large volumes of food. There are people that do this diet as raw vegans. They have to eat 10 to 14 pounds of food a day to not disappear. And so as long as you're including oil and animal products, which are of a high caloric density, you can't do both. You can't be a volume eater and eat. Well, let you explain it, Dr. Goldhamer.
The point is you have to get enough, but you can't get too much. If you get too much, we have problems. You have too little, there's 2 problems. In a natural setting, if you ate as much as you could whenever you could, and you were lucky and you were highly efficient, you got enough to eat so that you could live to reproduce. Remember, most humans probably did not live to reproduce. Our ancestors were the winners. They were the ones that could somehow get enough to eat and not get eaten. They went on that long boat ride. They managed to survive and probably ate everybody else for all we know. But the bottom line is, if you have winner genes, you absorb calories easily. If you have loser genes, you can eat whatever you want and never gain weight. That's not where our ancestors would have been. And so today, we live in an environment with highly concentrated foods. If we eat as much as we want, whenever we want, we're going to be fat. We can't help it. It's inevitable. So we have to either weigh and measure and try to control and discipline and regulate and punish ourselves, or we have to stop eating the foods that fool the satiety mechanisms in the brain. And that's the animal foods and the highly processed refined carbohydrates, the oils, the sugars. If we do that, we can go back to eating large amounts of low density foods, get normal satiety. And I'm not saying for everybody, but for most patients, that's enough to resolve their long-term weight management. And I can prove that now because we've got 1 year follow-up data on a population we did with a Mayo Clinic looking at cardiovascular disease markers. And we looked at these people, not just after fasting and feeding, at 6-week follow-up, and now at 1 year follow-up. And what's interesting is they've been able to maintain weight loss, normal blood pressure state, free of medications. Now, they've not all been 100% compliant, but they've done well enough with this dietary principle that they were able to sustain their weight loss. Now, that's not everybody. That happened to be cardiovascular disease patients. We got to look at people that are depressed, people that have eating disorders. There's lots of different populations out there. But we can at least show that people that were struggling with chronic weight issues that can make this fundamental difference, throw the scale away, eat large volumes of low density food and sustain it for a year. Now, a year is not 10 years. And I mean, obviously we've got some additional research to do, but if you can sustain a behavioral change for a year, you and I all know, we all know, that's a hugely statistically significant event because most people don't sustain behavioral changes for 20 minutes, let alone for a year.
It's such an interesting conversation because, when I heard you, because I wasn't part of that podcast interview, Vera, you and Clarissa interviewed Dr. Goldhamer back in 2021 already. I listened to that and I listened to the interview you did with Chef AJ for the Food Summit, for the Food Junkies Summit. And it just made me think like, maybe we're looking at this all wrong. Maybe there is no such thing as volume addiction. That's actually our biological drive to go for these foods. And we would have spent a lot of hours, right? So I think a lot of people are like, oh my God, I'm going to be eating forever and ever and ever. But meanwhile, I've got clients, I'm just trying to get to stretch their meal to 20 minutes so that they have, right, the signal from stomach to brain, like, hey, there's food here. And so
you're not supposed to eat in the time it takes to get it from the fast food takeout to the
right.
road.
Yes, exactly. Right. And so it is just starting to make me question, like, is volume addiction even a thing? Or when we have clients show up and say that, do we need to say like, maybe we need to look at this volume thing? Like it's information that you're not getting enough somehow. And so it just helps me. So when I think about then our clients who are, who fall into that food addiction category and they want to be volume and or vegetarian and or vegan, what should they focus on in creating that food plan for themselves? Oh, sorry, go ahead.
The fact that it's not necessarily volume addiction per se, but that they have less than normal satiety feedback to volume. So what allows them to overeat is they're not getting that normal, feedback, that trigger mechanism. And as a consequence, they'll eat to the point of pain. But part of that is when you eat foods without fiber, okay, now the volume and the caloric density is substantially higher. And then you're getting to other satiety feedback, pain mechanisms and stuff. So I'm not saying there's not a big psychological overlay here, but we may be looking inaccurately at what the problem for the patient is. If they had normal satiety feedback, they would be able to eat a whole plant food diet and get negative feedback that prevents or discourages overeating. But what if they don't get that feedback? What if those neurological mechanisms don't work as well for whatever reason, just less sensitive? That doesn't mean they're necessarily more damaged individuals. They just got less sensitive satiety mechanisms. And so then you have to, it's maybe really more difficult to strategize around it. And the point is they definitely wouldn't get away with eating highly fractionated foods. They might get away like AJ does, eating large enough volumes of low density foods where she can get her nutrient needs met without overeating. Whereas before she was trying to do that with discipline, and that discipline doesn't work in my experience very well. And also we look at a person that says, oh, if you get overweight easily, that's a bad thing. See, from my viewpoint, that's a good thing biologically speaking. That means you have survivor genes. Now, in the modern world, you're screwed because it's like everywhere you go, people are going to try to screw you up. But it doesn't mean that biologically you're damaged goods. It's just you're the one that in the natural setting would have made it. Because that's what your ancestors did. All those other ones didn't make it. They didn't pass on their genes to you. You got the winner genes. And when people start seeing it like, oh, I have a problem because I'm designed for a different environment, and I've been placed in this very new, very artificial environment. It's not that there's anything wrong with me. There's something really wrong with the environment I'm living in. Now we focus not on changing me as much as how do I change my environment? How do I make it so there's not all this tempting drug-like food around me everywhere I go? How do I encourage my friends not to treat me poorly because I don't want to participate in their self-destructive behavior patterns? How do we figure out how to make it so I have enough time? Because this eating this way is much more time consuming because you got to like shop and chop, and you can't go to the drive-thru and get 2,000 calories in 3 minutes. And and it's also socially a problem because everybody else is addicted to the artificial stimulation of dopamine in their brain. So when you start trying to set a better example, particularly God forbid if you're successful, you're going to piss people off, and they're going to start trying to actively undermine your success. Think about it all. Just use it, and alcoholism as an analogy. We don't tell newly recovered alcoholics, well, you should go get a job as a bartender. That's what you should do. Put yourself in an environment where you're constantly have to deal with these issues. But what do we tell overweight people? Well, eat less.
Okay, so just
where they're constantly being bombarded. It's not amazing that people have trouble with weight issues. It's amazing that more than 70% of people are overweight and obese.
Okay.
How come not 90% of them?
Just to go back to your concept of winner genes. What about genes when people have genetics that predispose them to diabetes, and what we would say that they're highly carb sensitive. So they eat a carb diet. Usually it's refined carbs, but not necessarily, and their sugars go up. Can you talk about that?
Well, sure. If you have damaged the islets of Langerhans and the pancreas to the point where you're not producing enough insulin, if that's the type of situation you're in, then you're going to be particularly vulnerable even to some whole plant foods like fruit. Fruit sugars.
Yes, fruit is a great example.
Hypertriglyceridemia, and in our diabetic patients that are highly sensitive, we remove fruit from their diet. We use complex carbohydrates. There is no complex carbohydrate sensitivity. In fact, even the American Diabetes Association recommends a diet very similar to what we're advocating, which is high complex carbohydrates, getting rid of refined carbohydrates. And then 80% of our type 2 diabetics achieve normal blood sugar levels without medication after a single intervention. So we know that diabetes is a reversible problem. Type 2 diabetics make more insulin. They just have insulin resistance. Insulin resistance is caused by the diet that makes you fat. It's not a problem with complex carbohydrates. It's a problem primarily with fat and oil, which contributes to insulin resistance. I know from clinical experience working with diabetics, you can achieve normal blood sugar levels without medication if you're willing to do dangerous and radical things like eat well, exercise, and go to bed on time.
So let's talk about eat. What do you mean by eat well? Because if they're eating fruits, that might be too much. So what kind of
complex? We may have to limit fruit. First of all, when you limit fruit, you get about grains, sugars, the dried fruits, the fruit juices. And then you're down to whole fruit. Now, some people can have some melons and berries, which have a lower glycemic response. Other people can't even handle that. And that's fine. You get rid of everything that they're not able to handle until they are healthy enough that they can handle it again.
So could that be like grains? They might have to get rid of grains, for example?
Complex carbohydrates are not a rate limiting factor. However, there are some tricks you can do for the most sensitive diabetics. And that's you include large amounts of green vegetable materials raw and cooked with those carbohydrates, because the fiber from the greens tends to slow the rate of absorption. But honestly, for most diabetics, we do not have to limit complex carbohydrates. If you have a problem with grains, you give them more legumes. Legumes have a lower glycemic response, and may be able to tolerate that if they can't. But the big key is if they eat enough raw and cooked vegetables with their more moderate calorically reasonable amounts of complex carbohydrates, you control their blood sugar levels. Now, coincidentally, you also control their weight. Mm-hmm. Although if you're a female, remember that part of the population that have trouble with, they lose weight at a rate 50% lower than their male counterparts, everything else being equal.
Okay, now the other thing that you said, I heard you say just sort of in passing, but it's a pretty important point, is that you said that fats will create an insulin response or a insulin spike, and I'm not sure how that you would explain that. Can you elaborate on that?
Well, I mean, the physiology is at the receptor sites, higher fat intakes causes more insulin resistance. So on fat status. They also you could use this.
Are you talking about the refined fats? What you call the I forget what the word is that you're using. Pardon?
Anytime you take a whole food and then hyper concentrate it. So
Yes.
fats are hyper concentrated in oil, flour, carbohydrates are hyper concentrated in flours. So people look at whole wheat flour, for example, that's a highly concentrated food.
Yeah.
That's not a whole natural food. If you take wheat berries, it's 500
Right.
calories a pound. You take bread, it's 12 to 1500 calories a pound.
Yeah.
So-
Yeah, we're on the same page there
Yeah,
for sure.
so we don't want to have hyper concentrated carbohydrates, but you're designed to eat carbohydrate. If you take the carbohydrate out of a diet, now you're on a high fat, high protein diet. There's only fat, carbohydrate, protein, and alcohol. Nobody's going to put people on an alcohol diet. Nobody wants people on a high fat, high protein diet. That means you're going to be burning complex carbohydrates. But there's a huge difference between refined carbohydrates and what happens physiologically and complex carbohydrates. There's a difference between carbohydrates that you get in vegetables versus grains versus beans. So, there are differences in there, but, honestly, the key for us is just shove enough whole plant food into people so there's not room for anything. If you can do that successfully, consistently, they win. They lose their weight, their blood sugar comes down, we get them off their medications. Now, you want to make it happen quicker, get them exercising. People can do walking, hiking, biking, swimming. It works a lot better than if they sit on their butt all the time.
Well,
And if you can get people sleeping enough.
what's your take on the whole concept of ketones and fat burning? Like, so you avoid the carbohydrates and you like literally just eat fat and maybe some.
What people do is they go on high fat, high protein diets to get a fasting mimicking effect. And that's when we know through fasting, because we do long-term water.
Yes, I know you do that.
And there's no hunger because in fasting, the brain changes from burning glucose to burning ketones, so beta hydroxybutyric acid.
Yes.
In that state, there's a hunger blunting effect. So what they've done is they've just taken people artificially and put them on a fasting mimicking diet as a high fat, high protein diet with no carbohydrates. They will feel less hunger. That's fine. And short term, they may lose weight. But the problem is it's not a health promoting diet. It's a health compromising diet. And they will develop gallbladder disease, increased risk for cancer, and other problems. They say, well, short term, they lose some weight. Well, that's great. But if you want to lose weight short term, you can cut your leg off at the hip and lose 40 pounds overnight. That doesn't make it healthy. And going on high fat, high protein diets is not a health promoting long-term sustainable program any more than fasting would be. You don't just put a person on a fast forever either. And to mimic the effect of fasting with a high fat, high protein diet is very disingenuous. And of course, if you look, there's no good long-term studies that show you improve overall health by doing that either. People say, well, we get some short-term weight loss. Anything in their mind justifies short-term weight loss, no matter how much you compromise people. They'll give you drugs that coat your intestine, that cause you to have anal linkage and explosive diarrhea, and pretend that that's health promoting because now you can eat your fatty foods and not gain weight on it. Not to me, that none of that makes a lot of sense. Yes, it does work though. You do get a hunger blunting effect.
Dr. Goldhamer, I just want to interject here for a minute because a lot of people in the non-vegan food addiction world, I think they're thinking you're fasting people because they're overweight or because they have food addiction. That is not why you're doing it. It's usually for medical reasons. And you don't generally fast people just because they're a food addict.
If they have diabetes though, for example, if we fast people, we can reduce insulin resistance in about 3 weeks. And then when we feed them a whole plant food, SOS-free diet, they can sustain normal blood sugar levels without medication. If they have high blood pressure, if you look at our study, 174 consecutive patients with hypertension, 174 people achieved normal blood pressure without medication. We have the largest effects that have ever been shown in treating hypertension in humans. So we use fasting to correct the problem, but then you have to eat a whole plant food diet, exercise, and get enough sleep. If you just want to lose weight, eat a whole plant food diet, exercise, and get enough sleep. You're going to lose the weight. If you're a woman, you're going to lose weight an average of about 2 pounds a week. For a man, it's going to be 3. So it's a lot easier if you're male.
Great. But you had me excited because you were like basically telling me I have winter genes. So I was really excited about that. And then you cut my legs out from underneath me because you're like, and you're a woman. So good luck to you. No, so
it just means if you're a woman, you have to work twice as hard to get half the results. So get used to it.
Yeah, right. Such is life, it turns out. So
not just weight loss, it's everything else too.
Yeah, exactly. So I want to talk about our bariatric clients. So when I'm thinking about our bariatric clients and I'm thinking about vegan, vegetarian, whole plant food based, and this idea of volume, how do you help your clients who have had some sort of bariatric
this
procedure?
Is a really difficult problem, and I'll tell you why. Bariatric patients, I mean, the basic model simplified was you're going to make overeating painful. You're going to get more feedback. And so what happens now is they can't just do what AJ does, which is just eat huge volumes of low density food because they literally can't eat enough food in order to get what they need without distress. So now you have to get into a much more calculated manipulation of the diet. Now, the trick still is eat as much whole plant food as you can, but eat enough processed food so that you can meet your caloric needs. But the way we process it is not by giving them oil and animal foods, but we use, for example, instead of eating rice, we might use a rice pasta. Instead of eating a vegetable, steamed vegetables, we might do a vegetable soup. So we'll process the food a little bit more so that we can work within their now limited, artificially limited, volume capacity. And then we might even have to resort to some supplementation or other things, just to make sure that, if we're depending on the person and what you're regulating and limiting, that we're going to get our nutrient density. I don't like pills and potions, but sometimes, as in the case of B12, that's the most effective and efficient way of assuring that you've got nutritional adequacy. And once you've gone in and manipulated the container, the feeding bag, so to speak, it does take a little bit more conscious effort. And what I would suggest is those individuals need to continue to be doing monitoring, basic regular testing, just to make sure that everything's in balance and they're getting their goals met. And it's particularly dangerous when you're going through active weight loss. During active weight loss is when it's possible to get into deficiency issues. That's when you want to be particularly vigilant. Because what's good for weight loss isn't necessarily good for long-term nutritional adequacy. So that's where guidance, and I really think anybody that's been through that type of procedure should be working with a doctor or a therapist that can help them, just keep an eye on everything and make sure that their overall nutritional adequacies are met. But not abandon the whole plant food model, just modify it to meet their needs.
Okay. I want to just jump in with a quick question. You mentioned fractionated oils. Does that include seed oils as well?
Yeah, anytime you take a plant and tear the cell apart and remove one hyper-concentrated component, that would be called an oil. Now, I don't have a problem with the use of seeds or the use of nuts, but you got to, even then you got to portion control. Here's the thing, even when you're eating whole nuts, it's easy to overeat it. With oils, it's almost inevitable. Oh my gosh, it's, how do you not overdo it?
Okay.
But so we do want the oils. We know these essential fatty acids are necessary. But we want to get it from whole foods. We don't need to have a fractionated food that's already gone through a process.
Okay.
Get it.
Go ahead.
Right.
Molly.
You want to be eating the whole food, masticating, creating, basically having it break down on your own.
Yeah.
Okay.
So
So
honestly, if you take people, even on the crappy diets that most people eat, if you just got them to eat their food and chew it up, they'd eat less. A lot of times they never get a chance to get the feedback mechanisms from eating because they're swallowing it. And most foods are designed to facilitate that. When you go look at those fast foods, they're designed so, there's only one or two chews because, honestly, people would be exhausted if they had to chew more than a couple times because their masseters become atrophied from disuse.
yeah, not to mention if we're drinking it, right? Like you were saying, like the protein shakes, that kind of thing, then we're taking all of
the
that
effect
away.
of beer and alcohol. I mean, men get those really attractive beer bellies that women like so much, and the plumber's crack. Because alcohol is like 7 calories per gram, almost no satiety feedback. It's inevitable. It's only a question of how fat do I want to be when we talk about consuming.
Yeah. Well, I have one last question for you guys, and hopefully, Chef AJ, you'll weigh in on this as well. I'm just wondering because you two definitely, I think, believe that there is such a thing as food addiction or sugar addiction or whatever label we want to put on it. And I'm just curious to know, have you guys, so we often get pushback from the eating disorder world. And I'm wondering if you guys ever get pushback from other vegan, vegetarian individuals, medical professionals, any of that. And how do you respond?
Get pushback from everybody. There's nobody that agrees with us on just about anything, because we're so contrary in terms of our whole model is different from the. And it's really frustrating too, because it seems so obvious. And, that's why we're so busy out trying to publish our outcome data to show that we can actually because it's different than what everybody believes. They really don't want to, some people will get rid of the oil, but they want to keep the sugar. They want to get rid of the sugar, but they want to, oh my God, talk about it when you reduce sodium intake. Now you really piss people off.
Well, can we talk about that? And I want to answer Molly's question too, if you don't mind, because Molly,
talk about passive overeating.
What's a little bit, can I just say what I got to say? Because it feeds into that. Thanks. God, I didn't know it's so hard to talk on my own show here. Anyway, Molly, to answer your question, because I don't get pushback really like from medical doctors, because I think that even if they don't agree, they respect and understand what I'm doing. And then I have people like Dr. Goldhamer that can say, hey, this is healthy. But where I get pushback and why I felt like I don't have a space in this world is because when I feel like I'm one of the first people that brought this concept of food addiction to the vegan world, other than Dr. Goldhamer, who had been doing it quietly for 40 years, but he didn't really, seek the limelight or be in the spotlight until he got on the Rich Roll podcast, and now everybody knows who he is. And so what happened was because I became vegan for ethical reasons purely almost 46 years ago, the community of ethical vegans basically said I was doing a disservice to veganism because I make it so much harder for people to be vegan if I tell them they can't have sugar, flour, oil, and salt. And the ironic thing is I actually got the Hall of Fame award, which I don't understand why these people gave it to me then, because I'm not trying to make it harder for people to be vegan. I'm trying to make it easier for people that suffer with food addiction that want to be vegan to get help. And so I don't tell everybody they can't eat sugar, oil, flours. I don't tell people they can't eat animal products, but I do feel that like in the food addiction world, nobody's really doing it vegan the way you guys are doing it. There's just really no vegan that really has a program other than maybe Dr. Goldhamer, but his program isn't for food addiction. His is just for health. And he does get quite a few food addicts. One of the things Dr. Goldhamer didn't talk about, and I hope he will, is this concept of taste neuroadaptation and why his diet is not just vegan, whole food, plant exclusive, but also free of sugar, oil, and salt. It turns out that I just got very lucky and landed on a diet that is beautiful for food addiction, because Dr. Goldhamer will hopefully explain next why the oil and the salt really do contribute to food addiction and overeating. And I'll let you take that now.
Passive overeating is a much misunderstood and underappreciated reality. If you take animals, for example, and let them eat to satiety, they eat a certain amount and then they stop. And if you take those same animals, but you salt that food, they'll eat significantly more, everything else being equal, before they stop, because it stimulates dopamine production in the brain. It tastes better. That's what tasting better means. It means whatever you're putting in your mouth stimulates more dopamine production in the brain. And salt does that. And so even though sodium is an essential nutrient, without it, which you will die, it doesn't mean we have to add salt to the food. And if you add salt to food, you will eat more before you feel satisfied, everything else being equal. And so a big part of obesity in our culture is that people are eating hyper-concentrated foods that are having chemicals added, salt, oil, and sugar. If you take, for example, flour and water, and you bake it up, it's called matzah, and it's punishment on Passover. If you take water and flour and water and add oil, salt, and sugar to it, it's called bread, and it's the staff of life, and people will, eat tons of it. So the problem is the salt, oil, and sugar are the food is a carrier agent for salt, oil, and sugar. That's essentially what chefs in our society do. Is they take a few grains or animal products and they learn how to deliver salt, oil, and sugar to the palate using those staple grains as carrier agents. And what we've done in our program is take whole plant foods, but eliminate the salt, oil, and sugar. When you eliminate the salt, oil, and sugar, you eliminate obesity for the vast majority of people, because it's like literally almost impossible without animal foods and salt, oil, and sugar to have people achieve and maintain obesity. They could still be a few pounds overweight, but they're not going to be able to sustain obesity because it requires fooling the brain, even in the most desensitized patients. Now, some people are desensitized enough, it's pretty easy. And other people, they would never become overweight. I don't care what crap diet they ate. We know Dr. Lau, right, AJ? I've known him since 4th grade. He didn't matter what diet he ate, he would never be overweight because he has really sensitive. He's the guy. There's 2 cookies in the package. He would have half of one and put the other away. Whereas I would eat the cookies, the package, everything. So it's not because he's disciplined or mommy loved him better. It's because he has very sensitive satiety mechanisms. And somebody else, everything else equals psychologically, but they don't have very sensitive satiety mechanisms. They're going to gain weight. So I think a lot of our eating disorder people just naturally have a little bit less sensitive And then they superimpose on this. If you, for example, put weight, particularly in a female, there's all kinds of social problems that come about because of how they're treated, because of how females are evaluated, et cetera, and all that stuff. And so now all those problems come up and we attribute everything to those problems. That may not be the case. It may be, much more basic biological differences that superimpose with all the crap that they have to put up with as a consequence of those differences. And if that's true, it may explain why we see, even in our quote eating disorder patients, pretty consistent results in terms of them able to improve biological control and obesity, even though we're not addressing all the psychosocial consequences. And I'm not saying that wouldn't help. Maybe we would do even better if we could actually get them cognitive behavioral therapy and the kind of support that seems helpful. But I think sometimes people when they decide everything's psychological, they forget that there's a lot of biological control, and they might get better results if we did more of the, whole plant food stuff and saw where things work out. I don't know.
Thank you.
What for AJ?
Well, you mentioned like with people with gastric bypass pasta, Dr. Goldhamer, those of us that identify with food addiction, we don't eat any kind of pasta, even the one ingredient pasta, even the lentil pasta.
Right. Because it's hyper concentrated.
Yeah.
If you were in a situation where you were trying to get more calories in, like for example, let's say you're trying to feed kids and you're trying to get more calories in so that when they go to school, they get that federally subsidized school lunch program, they don't eat too much of it. Well, if you give them hyper concentrated calories, like say a rice pasta, you're able to get more calories in the volume of time that you have available. So it's exactly the opposite of what you do when you're trying to control weight. And in the case of a person with a gastric bypass, if they're not able to get enough nutrition from all natural foods in, that's one way you could manipulate it.
Dr. Goldhamer, one of the things, and Molly and Dr. Tarman can tell me if this is true with the people they work with, but as in some of the food addiction circles, like they don't let them have any fruit at all. And when I think of fruit, I'm not talking about just sweet fruits like dates, because I think dates are 1,300 calories per pound compared to say blueberries, which are low glycemic and 200. But, there are things that are fruit that are not sweet. Tomatoes, eggplant, bell pepper, okra, zucchini, cucumbers. I mean, to me, these are fruits as well. They're not sweet. But a lot of people in food addiction circles say, well, they just can't have bananas. They can't have cherries. And sometimes they can't have any fruit. Do you think that sometimes if people have just suffered for such a long time that they really can't have these foods, or is it because they're being told
you
that
don't
they
restrict
have
those foods except in the most sensitive diabetics, AJ? And honestly, if you're talking about whole food and you're talking, even dates are dehydrated and concentrated. So I don't know if I treat them the same way, but I'm not talking about fruit juices and I'm not talking about dried fruits, but whole fruits, particularly berries and melons. We don't restrict those, and it's very rare that we have to limit it, even in the diabetics. Most of our diabetics still are able to eat those foods, particularly if they're willing to take it with some lettuce and celery and cucumbers, and so that the sugar that is inherent comes in over the food.
Right.
Also, if they're really good, they chew it too. That helps.
And things like sweet potatoes and rice, they say that like never. I mean, if you're a food addict, never have those foods. Maybe
never restrict those foods. Never restrict those foods, and it doesn't appear to be a problem.
Okay. Do you have any more questions, Molly or Dr. Tarman, for the good doctor?
I mean, I think that really covers it. At the end of the day, I'm really happy to know that I could probably reach back out to you too, if I get stuck with a client or direct other clinicians to the two of you as well. At the end of the, I think just knowing that, there are special considerations that need to be made when we have, bariatric stuff, diabetes, that kind of thing. But it sounds like they're not like these big problems that don't have solutions. They just take special considerations. And there's just a bit more support, I think, that goes into vegan and vegetarian, because it is, like you guys were saying, like you two experience pushback on this way of eating. So now when you have somebody who has food addiction and they want to eat that way, right, and it just kind of starts to compound. So just to remind myself and other clinicians, it's just about making sure that we're willing and ready to support and find the right support for.
I think there's one other key thing we didn't talk on. If we have just 30 seconds, AJ.
Yeah.
People think what their cravings and their binging are always psychological. Sometimes maybe that's true. I don't know. But I know one thing is it's biological, which is when blood sugar levels go up, and insulin goes up, and then blood sugar is driven down. The brain thinks you're starving and it wants you to eat, and no more salad because that's not going to impact the blood sugar quickly. And so when people are eating refined carbohydrates, their blood sugar and insulin levels are bouncing all over the place.
Sure, yeah.
And when you go on a whole plant food diet, one thing that happens right away is blood sugar levels begin to stabilize, insulin levels begin to stabilize. And we know, particularly post-fasting, which is something we do in a medically supervised setting, those blood sugar levels, those insulin levels, once they're stabilized, a lot of the quote binging and craving and stuff becomes much less of a problem because their brain's not telling them that they're starving to death or they're going to die. And so sometimes maybe it's psychological, sometimes it's biological, it's probably a little of both. But you can stabilize the physical part of it just by going on a whole plant food diet.
Okay, I do have one more question before we close off. And Chef A, I want to address this to you. As somebody who's plant-based and very focused on food addiction, the awareness of that, what's your take on just the desire to still chase the sense of sweet, either through a sweetener or through some kind of food product that looks like a dessert but isn't actually?
First of all, I think people sometimes have to run experiments because not everyone is the same. I do believe that the people that suffer from food addiction are all sensitive to sugar, flour, and alcohol, but not always to the same degree. And I think after a long period of recovery, some people can reintroduce small amounts of some things. Now, I don't mean sugar, flour, and alcohol, but for instance, I didn't eat dates for 10 years. I don't really seek to eat dates now. They're too sweet for me. But if I'm traveling and I'm at an airport and I can't get food, I can eat a few dates and I'm not going to go off the rails. I'll just say, my God, they were really, really sweet. So I do think people should run these experiments themselves, but I don't think they should do it early in recovery. I believe in an abstinence-based food plan. And that's what Dr. Goldhamer's plan is. It's even more abstinent-based than some of the strictest plans. But I don't think you can paint everyone with the same brush. I think it's a one-size-fits most, not a one size fits all. And that said, I think for people for whom weighing and measuring works, they should do it. But I never understood why somebody would be limited to 7 ounces of vegetables. People that say they can overeat on vegetables, it's probably because they're hungry and they're not getting enough food on their food plan. So I think it can be very dangerous for some people to dabble in this dessert arena, really. And so this is why people have to know themselves and listen to them.
Does that include stevia too?
Oh my God. I personally think that the sugar alcohols, I think personally from the people I've worked with, that the 0-calorie sweeteners are worse than sugar. And believe me, I don't think sugar is a health food. I don't recommend it. But at least when you have sugar, it's more natural in that you're getting the 4 calories per gram that was in the sugar. And the taste buds on the tip of your tongue, when they taste sweet, your brain thinks, oh, calories are coming. I think stevia, erythritol, xylitol, monk fruit, lohan, coconut sugar, I think that's it's sugar is sugar, oil is oil, salt is salt. If you want to eat it, fine. But you can't play this game. Well, my sugar, my low tar cigarettes are better than yours. No, it's worse because the sweetness of things like stevia and erythritol, they're so fake. And I've had people that are more addicted to that little dropper of stevia than they ever were of sugar. And so what they're basically doing is trading one addiction for the other. Now, you could argue in the case of a diabetic, maybe they're doing less harm, but then you have to go through the whole conversation. Well, what's better, abstinence or harm reduction? I'm a fan of abstinence, but guess what? It turns out that a lot of people, most people can't do it.
Yeah. Okay. Great. Thank you.
There's never been evidence that those artificial sweeteners are effective as a weight loss strategy. So it's clear that they're not effective at helping people, mitigate.
I think they perpetuate the desire for sweet. I personally don't think if somebody eats some cherries, they're going to go binge on a Black Forest cake. That might be a person, but I think the stevia and the erythritol, it's so sickly sweet in such an unnatural way. Even, another thing that a lot of people don't realize is those natural flavors. I've had people that have had something with 0 calories. It's called gosh, think of the name of the soda. It's guys, help me out. It's this soda.
Stevia.
It's not stevia. It's a different brand. It has 0 calories and there's like a coconut flavor, but it's natural flavors, and people cannot stop drinking these. So they may not be getting calories, but listen. If it comes from nature, if it comes from a plant, eat it. If it comes from a plant, don't eat it. And you know what? There's no yes, there's a stevia leaf in nature, but the people that are using stevia aren't using the leaf. They're using the highly processed liquid. Right. Spindrift is okay. It's the other one, guys. Spindrift is
LaCroix?
LaCroix, that's it. I think LaCroix are addictive to a lot of people because I see people that will drink 12 of them because there's something about these natural flavors that just, excite us. Dr. Goldhamer has this thing that says, if you like it, you can't have it.
All right. Okay, on that note.
Well, guys, this was a wonderful, thank you guys. And I appreciate everybody, not that I expected anything less, but everybody being so respectful, because one thing we all agree on is that processed food is not food, whether we're vegan or not vegan. We shouldn't be eating it. We shouldn't be feeding it to our children. And if people would just stop doing that, a lot of people would start to improve.
Right on. Thank you, Chef AJ.
Thank
Yes,
you.
thank you.
Thanks all of you. And thanks all of you for watching
Thank
the
you,
14th.
Dr. Goldhamer.
Yes, thank you, Dr. Goldhamer. It was really wonderful.
My
Thanks
pleasure.
all of you for watching the 1400th episode of Chef AJ Live. I looked it up in numerology, and 1400 means success. And I wouldn't have been a success if it wasn't for the wonderful viewers like you. Take care, everybody. And remember,